Hi there, my name is Dr. Chibuki and I head the medical operations at Baby Bliss. I'm here to show you pointers on how to select a hospital for your antenatal care and delivery. One of the very first things a woman should consider is the hospital reputation. You should ask around. You should ask around to know what this hospital is known for. Some hospitals have very good reputation when it comes to maternity. We at Baby Bliss have carefully curated and selected hospitals. We have vetted these facilities because we know that these hospitals have passed can offer good services. We've done our due diligence and we can say that these hospitals offer wonderful maternity services. Even if we don't have this hospital on our network, you should let us know and we can offer you specialist advice. Do you have health insurance? You should also ask your health insurance company for the services or for the hospitals that render maternity service on their network. If you don't have health insurance, that's fine. You can ask us. We have partnered with Hygia HMO who has created a special health insurance package for mothers. We can also offer you discounted maternity rates. In choosing a hospital for delivery, it's nice to ask if this hospital is a baby-friendly hospital. Please don't take this literally. This just means that the hospital encourages exclusive breastfeeding. And that means that the hospital encourages mothers, regardless of if you had your baby vaginally or through cesarean section, that the babies are put to breast by 30 minutes of birth. That is what we call a baby-friendly hospital. So if your intention is to deliver your baby or feed your baby via exclusive breastfeeding, it's nice to ask if the hospital supports that. And if it's something that they don't, you have a choice to, tailor what you have initially planned and what the hospital offers you. Something that's also very, very important is, does this hospital offer antenatal classes and birthing classes? Now, antenatal classes are usually organized by hospitals, where they gather women together and women can ask questions on what labor pain feels like, what induction of labor is, and how to push during delivery, what the healing process is from having a cesarean birth, and all of those questions. You get a chance to meet the consultants and the midwives at those classes. It's nice to know that. However, if your hospital doesn't offer antenatal classes, you can ask whatever question you want to ask on our app. We have a community of women on our Baby Bliss app, which has over 20,000 downloads. You should download the app today if you haven't. It's good to ask what the nursing to patient ratio is and what the consultant, obstetric and gynecologist doctor to patient ratio is. This is so that you know that you have a focused, more detailed, more one-on-one personal interaction with your nursing staff, midwife, and even the doctor. Lastly, there's some sets of questions you should ask your hospital that you're choosing to have your baby in. How long do they keep their patients for? By keeping, I don't mean arresting you, but at least monitoring you post-delivery. If you're typically have your baby vaginally, you should be monitored in the hospital between 24 to 48 hours. If you deliver via cesarean section, you should be monitored, approximately about 5 days. So you should ask the hospital and what plans do they take when this is, during your admission and post-admission. Other questions include, is the labor ward on a different floor from the theater? Is the theater different from the ward? Just so that you understand the flow around the hospital, because you don't want to be wreaking in pain and going through flights of stairs or going through an elevator. It's nice to have, all these facilities on the same floor. Having watching this video and listening to the points I have listed, I hope you're in a better position to make an informed decision on what hospital to choose to deliver your little one. Bye for now.